video that will be played before we start.
Okay,
So
so after the video, is that when I go and introduce and then I hand over to you? Can I call you Ayo? Or I'll
okay,
introduce you as Dr. Breast.
I'll be admitting people now. Thank you.
Yes.
An African health network. Ever sat in a doctor's office thinking they just don't get it? Or search for health advice online but you can't understand it? Felt unheard? You're not alone, and you found your solution with Health Hour. Every Saturday at 11 a.m. This is your space where Caribbean and African healthcare professionals speak about health with a focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more. All with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health expertise.
Hello, all. Good morning, and welcome to this wonderful session today on hypertension, which is popularly known as the silent killer. And who is the best person and to give this talk today is Dr. Ayo Olatoye. He's a consultant in acute medicine at Merseyside. He has various interests, which include he's a transformational mindset coach. He's an author of Building Blocks. You can get the book online. You can maybe hear about it later. Is a must-have. He's a specialist and expertise in burnout. Sleep is also on one of it. He's an expert in that, and he's a leader. Dr. Olatoye is a sought-after speaker and a podcaster dedicated to empowering individuals and organizations to thrive. Let's listen to Dr. Olatoye. There's a lot to learn today. Thank you, Dr. Olatoye. I'll hand over to you.
Thank you so much, Dr. Nnekbu. I really appreciate your warm introduction. You guys, she told us how old she was before we started recording. I don't believe her. I don't believe her. I'm gonna have what you're having. Let's let's put it like that. So yeah, thank you again to Khan for this morning. I see some of my family in the waiting room and on the Zoom. So Ekaro and Bon dia to everybody who's here. We're gonna have a good time. So let me share my slides and then we can get going. So can everybody see my slides? You can see? Okay, wonderful. So our conversation today is going to be about high blood pressure. We're going to talk about issues in terms of race inequalities and unconventional ways of dealing with it. Again, I always start these conversations with thank you. So I want to say thank you to Khan for the opportunity. You could have picked somebody else, so thank you for picking me. I want to say thank you to everybody who is watching live and everybody who is going to watch on YouTube or other platforms. One of the big things I really appreciate about Khan is they are an organization who understands that a rising tide raises all boats. They're not gatekeepers to information, and they're doing their best to help reduce inequalities as it pertains to health in Black community in the UK. So thank you very much, and thank you for everybody who is listening and who's logged on. So, who am I? Why does it matter? Who am I? So I am many things. I am a Christian, husband, father, brother, I was going to say sister, not sister, uncle. So this is my beautiful wife, Paulina. These are my children, Ezekiel, Hannah, and Sophia. This is my dad. This is my mom. I'm a speaker. I'm a musician. I'm an author. There you go. There. I'm a stroke survivor. Maybe we'll talk about that later. And as a hobby, I'm a consultant in acute medicine. I work in Merseyside. So the reason it's important is because all of these things, we bring all of these things about who we are wherever we are. So you're going to hear bits of Ayo the doctor, Ayo the dad, Ayo the son, Ayo the brother, Ayo the husband. And to you, I am your brother and your nephew. So everything I am saying is for the purpose of trying to make your life better. One of the big things that I want to always talk about when it comes to health is in my belief, we are three parts. I am a spirit, I have a soul, and I live in a body. And for me, health and good health in general is all of these things being in balance. So have you ever noticed when you don't feel physically good, those of us who are people of faith, you don't want to pray, you don't want to read your Bible or whatever. Why are these things related? Because we are all three, and being in good health means all these three things being sorted out. I can't tell you as an acute medicine consultant how often I am seeing somebody who has very real physical symptoms being contributed to by where they are in their mental health. So we have to talk about all of this. Now, our conversation today is about high blood pressure. So we're going to have what we're going to talk about. The objectives are, let's discuss the impact of hypertension on health, particularly in African and Caribbean societies. We're going to explore unconventional but evidence-based lifestyle interventions, and we're going to empower people to have a strategy to incorporate these into their daily life. Because there's no point knowing the thing to do, but the thing to do is, go to the gym 6 times a week. Not everybody can do that. How can we do the things that we need to do and make it part of our daily life? So that's what we are going to talk about. Okay, I am fascinated by this, God's original idea. This is something I've coined. I believe that before we had industrialization, there are so many things that we just accepted. We slept when it was dark. It was cold when we slept. We didn't have noise. We didn't have light. All of these things were in the original communities. And as we have become more industrial and become more commercial, and we've gone to convenience and made life easy for ourselves, we've moved away from these things, and we have realized that some of the things that we took for granted historically in terms of the original communities are beneficial. We used to live in a village next to each other. One of the things that we forget is that community is protective. We're going to talk about it in terms of high blood pressure later. When you sleep, you need cold and dark. So having central heating and electricity, if you're not careful and you misuse it, some of these things go against you having a good night's sleep, or even have control of your blood pressure. So I'm fascinated about that, and a lot of my conversations are about how can we think about moving back into a position that is optimum for how our bodies were created. Okay, we talked about this. Right, so when people say blood pressure, I have blood pressure, what is blood pressure? What is the definition of blood pressure? So blood pressure is the force of your blood pushing against the walls of your arteries every time your heart beats. If you think about it, it's like the pressure of a water through a hose. If it's too high for too long, it can damage the pipe. That's your blood vessels. So you know that, let's say you were watering your garden, or even if you were painting something through a pressure washer, there's a conduit that takes the water from A to B. And if that pressure is too high, there will be damage. So think about that when we talk about blood pressure. Now, there are two numbers that we use when we're describing blood pressure. The top number is called systolic. That is the pressure when your heart pumps. The bottom number is called diastolic. That's the pressure when your heart is at rest. Systolic, diastolic. And when we describe blood pressure, we always use two numbers. Normal is 120 over 80. That's normal for most people, especially when they're young. So the reason it's important is because one of the things I always say to people is informed is armed. As a doctor, it's so funny to me when people come and say, oh, I went to the doctor, I went to the GP, they told me my blood pressure was okay. And I say, well, what was it? And they say, oh, I don't know. You need to know your numbers. This is your life. This is your blood pressure. You need to know what's normal for you in your age range and whatever. And when someone says okay, you need to know what that means. So blood pressure is two numbers, systolic and diastolic. And systolic is the pressure when it contracts, and diastolic is when the heart is at rest. So, excuse that. Right, so this is a normal blood pressure depending on your age. There is an expectation that blood pressure slightly rises as you get older. So this is according to the current NICE guidelines now. So you can look on there, and again, this information is going to be on YouTube, so you don't need to make any notes. It's just going to be there. You can freeze the screen. 120 over 80, if you're less than 50, is what you should be aiming for. 125 over 80 if you're 50s, and again and again. Now, I am probably a little unconventional as it pertains to I like people to have a bit more of an aggressive control of their blood pressure. So for most people, unless you're starting to feel dizzy, I would advocate go as close to 120 over 80 as possible. There's some data to suggest that the lower your blood pressure is, as close to 120 over 80 for as long as possible, is protective when it comes to the complications of blood pressure, which we're going to come on to. So you've got that information. Fine. Key messages. It's normal for blood pressure to rise slightly over age, but above 140 over 90 and any age is an issue. High blood pressure needs attention. And the crux of the matter is African and Caribbean people, black people, were more likely to develop high blood pressure earlier. So regular checks are vital, even if you feel fine. That's why hypertension is called the silent killer, because most people have no symptoms. So don't wait for symptoms to go and check. Okay, so why should we care? Why is it important at all? So important that Khan have asked me to talk about it. These are the facts. 58% of black adults have hypertension. That's more than half. The highest prevalence significantly amongst the national average. So we've got here, this is white adults, this is national average, so this is everybody, this is black adults. It's important. So it affects us more than it affects others. Black adults are 3 times more likely to develop hypertension than white adults. And there's an increased risk of severe complications. You have to think about it. The problem with complications with blood pressure that's not controlled happens in a place where the blood vessels are small. So your arteries take blood away from your heart. Then they get smaller, you get to arterioles and capillaries and stuff. So where you have small blood vessels, if the blood pressure is too high, that's when you get damage. So stroke, that's one of the places, because the blood vessels in your brain are quite small. You can get renal disease. Renal pertains to kidneys. And there are some people who are on dialysis today, and the reason they're on dialysis is because for a long time, their blood pressure wasn't appropriately controlled. Congestive cardiac failure. Heart failure can happen in people who the blood pressure was okay, so maybe 145 over 90 for a long time, and they had no symptoms, and then 10 years later they come and see me in hospital breathless because the pumping function of their heart isn't as good as we would like it to be. That's what we mean by heart failure. So it matters. That's why we should care. There are some other issues. So this is a relative risk here of stroke as charted by somebody's average blood pressure. So you can see that as the blood pressure gets higher, the risk of stroke gets higher. In terms of stroke, the risk of stroke doubles as blood pressure elevates. Now, so the units that we measure blood pressure in is millimeters of mercury. That's what this is, mmHg. Millimeters of mercury. So 120 millimeters of mercury over 80 millimeters of mercury. For every 20 millimeter of mercury systolic increase, it doubles the risk of stroke. Now, the reason I'm telling you all this is not to scare you. It's to inform you. As I said before, informed is armed, because now I know what I am targeting and now I know what I am risking. One of the biggest issues that I see in terms of black people and people in general is an avoidance. You know, we talk about health issues and people are saying, oh, you know, God forbid. God forbid doesn't change the things that you're doing in your daily lifestyle, or the things you're eating that are contributing to blood pressure. And don't get me wrong, I'm a Christian. I believe in prayer. I believe in healing. I believe in all of that. I also believe that God gave us free will. And there are things that I might be doing that are contributing to my blood pressure being higher. God is not going to intervene when I've made a choice consistently to do something that's going to make that hard. I hope you understand that. So 20 millimeter of mercury increase doubles risk of stroke. So that's not a therefore you're going to have a stroke. It's risk we're talking about. This is a statistical measure. And the first stroke age disparity. So black adults experience first stroke at an average of 45 to 55 compared to 65 to 70 in the white population. I was 39 when I had a stroke, and I know that we are beginning to see a slight lowering in the incidence of stroke in people in our community and worldwide. But the data suggests that black people in general are hit sooner than other people. What else can we see? In terms of organ damage, we talked about it before. When your blood pressure is high, it starts to affect the organs. So in the black population, we show 1.2 to 2.4 times higher rates of high blood pressure related organ damage compared to other people. So we can't put our heads in the sand anymore. We can't ignore it. It's an issue. Stroke incidence is 2 to 3 times higher. And early intervention, blood pressure control before age of 45 reduces stroke risk by over half. So these things are important. And again, my job is to help you understand informed is armed. This is not a time to look at the data, to hear this information and think, what am I going to do? No, you put yourself in the driving seat of your heart, of your life. Remember, this is your life. No matter how much your GP loves you and your family loves you and the hospital loves you, the person who is in the driving seat for the significant changes that you can make is you. But you need to know why. So again, I'm sorry, there's a slide there that's not, come on, forgive me, I'll move on. Okay, so these are the conventional blood pressure medications. There are different kinds. So diuretics, they remove excess salt. When you remove salt, you reduce your blood pressure and you relieve water. There are drugs called ACE inhibitors. They relax your blood vessels and as a consequence, reduce your blood pressure because stiff blood vessels increase the blood pressure. There are calcium channel blockers. They help blood vessels stay open and relaxed. They're beta blockers. They slow heart rates, and they are ARBs, which are like ACE inhibitors. They do very similar things. Now, some of you might recognize the names of these medications. So full disclosure, I am on a medication called amlodipine. It's a calcium channel blocker. And depending on your age and other issues in your health, past medical history will determine what medications that you're on. And some people need more than one medication. We used to think you start with one and go to the highest dose, but the newest data is suggesting that you might start with 2 at a low dose and reduce. But the thing is, when people tell me, oh, does that mean I may have to take this for the rest of my life? You may do. But you have to think about risk versus reward. I was having a conversation with my son this morning, and we were talking about in life, most people choose what they want right now versus what they want most. I would argue that nobody likes taking medication, so we can just get that out of the way. But everybody probably wants to be healthy for as long as possible. But that might be a 10-year vision, 20-year vision, 30-year vision. But you want that more, I would argue, than the discomfort or inconvenience of taking medication today. And the problem is that we focus on the wrong thing. I don't like this medication. I don't like this label. I'm just saying, fine, but now we're all grown-ups. We have to start thinking about, what do I want most? I want to be healthy for as long as I can, and that might require taking medication today or maybe for the next 10 years to reduce a problem I might get later. There are lots of data to suggest even things like dementia is contributed to by poorly controlled blood pressure. So let's think about a wise man doesn't have to make their own mistakes to learn everything. Let's learn that the data suggests that poorly controlled blood pressure increased risk of stroke, high blood pressure, dementia, and all of these things, heart failure. I don't want that in 10 years. So therefore, let me get control of my blood pressure today. So there are some treatments and lifestyle. Now, there was conventional Western medicine is great in an emergency. It's great, stroke, high blood pressure, stroke and heart attack and things like that. But there are lots of data that telling us that it's not necessarily the way to look at long-term health. Most people that I see in hospital have a deterioration of a long-term health issue rather than a completely new problem. So the way to think about it, and which is difficult in society because conventionally human beings, we value intensity over consistency. If I told you that you had to run a marathon once a year and your health would be fine, most people would rather do that than not eat pizza every week or put down the cake or things like that, because we would rather do something intense but not frequently than do something small but every day. So what can we do? DASH diet, that's a diet, all of these things you can research online. A diet rich in fruit, vegetables, low-fat dairy, and all of these things can lower blood pressure by 8 to 14 millimeters of mercury. So again, the data has proved, let's say your blood pressure is 142 over, 142 over 90 or 80. And then you consistently change your diet, your blood pressure might now be 130, 134, 135, 136 over 80. And by simple medications. Now, I'm not saying this because I want you to avoid taking medications, because some people might need medications and it's not an either or. I am taking medication and I am watching what I eat. Reduce salt, especially in our community, the kinds of foods that we eat, the kind of seasoning, the way that we like our food. Sometimes we're putting more salt than it needs to be. The thing to remember is that your taste buds will acclimate. There was a time when I used to drink hot drinks and I used to drink tea, and I would maybe put 2 or 3 sugars in there because I wanted to taste the sweetness. And then I realized, hold on, I don't want diabetes. So I reduced the sugar and I started, when I was drinking tea, drinking it with no sugar. Now, eventually, my taste buds acclimated to it, so it didn't taste as offensive as the first time. But it's just about persistence. So similarly with the salt, yes, if you reduce the salt, it may taste differently initially. But remember, we are grown-ups and we're mature, so we are choosing the thing we want most, good health in 10 years' time, rather than the thing we want right now. Physical activity, regular exercise, 150 minutes a week can lower your blood pressure by 5 to 8 millimeters of mercury. And I would even say, so don't call it exercise, call it movement. There are lots of things you can do. So at work, my office is on the 3rd floor. I have promised myself I will never take the lift. Why? And not only do I not take the lift, I try when I have the opportunity to run up the stairs. What am I doing? I am finding a way to put exercise in my day. I'm trying to get my heart rate up, because it's not just the walking at a steady pace, it's doing it to a place where your heart rate rises, and you may have a let's say you go for a half an hour brisk walk, you may be sweating a little. You can talk, but you couldn't sing or hold a long conversation. That's how far you need to push yourself, because if you're not doing it properly, you're not getting the benefits from it either. Can you walk rather than take your car? Can you get off? Can you park further than the place so you can walk? Can you get off the bus earlier or the tram earlier? All of these things. Can you, when you are at home watching a movie, maybe do it standing up, maybe do it whilst you're doing squats, maybe there's lots of ways you can do it. Where there is a will, there is a way. Medication options. And again, there is a big issue with medication. We'll talk about it later. It with regards to in the Black community in terms of mistrust of medications. But the reality is some people need long-term medications. So let's not avoid it. We can't put our heads in the sand because it's your life. There are treatment plans that account for Black dietary patterns and health beliefs. But if you don't investigate, you won't know. And let's face it, in terms of population, my understanding is the population in the UK, I think we are between 3 and 5%. So there might be some things that are particular to Black people that your GP may not know, which is why I'm so grateful for the platform that Khan has created, so we can have, do you know, on their YouTube channel, they have hours and hours and hours of information about health as it pertains to Black people. Maybe we watch one less Netflix show a week and we spend time educating ourselves about high blood pressure, about stroke, about diabetes, and putting ourselves in the driving seat. And one of the big phrases I've been saying for the last couple of years is we have to take better care of ourselves. So the Khan YouTube page is a fantastic way of doing that. So again, these are the issues. End-stage renal disease. So this is somebody who has kidney problems that are bad enough that they probably should be on dialysis. Black adults, four times higher risk. Dialysis disparities. 58% of Black people with high blood pressure require dialysis earlier than other groups. Here's some case studies. So somebody who's called James, who's from the Caribbean, uncontrolled hypertension for 15 years, now requiring dialysis 3 times a week. And the only issue was blood pressure that was poorly controlled. There are some evidences that, there's a burden because you have to get to and from dialysis, so that it can cost, up to £45,000 annually per patient, creating financial burden for the family. So not only is there a health issue, but there's an economic issue as well, and quality of life reduction. Dialysis controls or is a major part of your life if you have to do that. So let's avoid it if we can by making sure that today our blood pressure is as controlled as possible. Now, there are some issues as it pertains to Black people when it comes to healthcare. So we know that there's bias and racism in healthcare. We know that. There are systemic inequalities. This is why Khan has the platform that it has. We know that there is evidence of historical abuses and discrimination. So there's a mistrust. There's a mistrust. We talked about it when I did when Dr. Oge did a talk about vaccinations. There's a mistrust in general, and specifically when it pertains to COVID as well, because the people that are reassuring me that it's okay are the same people who represent the organizations who are discriminating against me. So let's be honest about it, which is why, you know, Khan's platform for having black doctors coming to tell you the truth is really important. There's implicit bias. We know the data is that when you come and present in hospital, if the person that you're speaking to isn't educated, there may be ways in which that they look at you differently or treat you differently, not intentionally, but as a consequence of a bias they may not have recognized. There are cultural and language barriers that pertain to differences in the outcomes, because again, we've looked at when you chart outcomes by race, black people in general do worse. There are spiritual and religious factors. This is a big thing for me, you know, God forbid, and all, and all that kind of stuff. So let me touch on that for a minute. As a Christian, and you know, as a PK, you need to know my credentials. I'm a pastor's kid. What I would say that at 100% God can heal, 100%, and I believe that faith doesn't deny the facts, and true healing can be proved. So you don't say, I feel better, and never get checked. I know people who have done that. No. If your blood pressure is actually better, when we measure it, we will see. So it's important for us not to, because to me, that's not a faith issue per se. That's probably an avoidance thing, and we're just using the language of religiosity. If your blood pressure is better, when we check, we can see. And if it's not better, it doesn't mean that God can't heal. It means that for you, there's a process that maybe he's working on. It doesn't mean stop praying. All I'm saying is that if you're on medication and you feel that you're working towards not taking it, that there is a way to do that. There's a route to do that. It's not just I feel like I shouldn't. I believe that like I said, God can heal, but healing from God can be proven. So when I test it, your blood pressure is better. And it's not just a one-off reading. As a doctor, it's important that I let you know that your blood pressure fluctuates through the day all the time. That's normal. So a high or a low one-off doesn't necessarily mean that much. For me, the trend is more important. So if I see one high, I don't stress out. And if I see one low, that doesn't mean you should stop taking medication. I'm hoping that's going to be addressed in the conversations later. So we've talked about medications, we've talked about blood pressure, we've talked about risks. We're going to talk about some unconventional blood pressure treatments. So there's a 4-7-8 breathing technique, which is a diaphragmatic breathing, which alternates nostril breathing, activates the vagus nerve. And the evidence is that it shows sustained blood pressure reduction. I think I have a video about that later. Breathing is so important. Okay, so let me show you this video.
The 4-7-8 breath that I teach is the most powerful relaxation method that I've discovered. It's very simple, requires no equipment, takes very little time, costs nothing. And it is a practice. It's something that you have to do regularly. So in this technique, you breathe in through your nose quietly to a count of 4, hold your breath for a count of 7, and then blow air out through your mouth audibly and forcefully. And you do this for a total of 4 breath cycles. So I'm going to show you what this looks like. and that's all. It's a bit hard for me to come back and talk to you after I do that.
So you can see the 478, and again, you can research about it. Breathing is really important. Essentially, what's happening with that is that it's increasing the pressure in your thoracic cavity, putting pressure on your vagus nerve, and the vagus nerve runs down your body. And what that does when it is compressed is it lowers your blood pressure. Okay, so unconventional treatment number 2. Walking. Did you know that 30 minutes a day for 5 days a week, brisk walking, so you can talk but not sing, can reduce your blood pressure? And the ways to do that is walking groups. I know some people who, were advancing in age and had a walking group and their blood pressure was high. They were able to reduce their systolic blood pressure by between, I think, 5 and 10 millimeters of mercury just by walking. So it's important to understand that. Now, especially in winter months and things like that, the consistency is the most important thing. But brisk walking, just being outside walking leisurely, doesn't do it. Brisk, intentional walking, 30 minutes, 5 times a day. So after 3 to 6 months, we can reduce your systolic by around 7 millimeters of mercury and diastolic by 4 millimeters of mercury. And again, walking is free. Breathing is free. DASH, so we talked about this and we're going to talk about it again. Emphasizing fruits, vegetables, whole grains, lean proteins, low dietary fat, whilst reducing saturated fats and sodium, so fried food and things like that. It can lower systolic blood pressure by about 11 millimeters of mercury. And again, it might just be that you do more than one of these things to help you. Increased potassium intake. So what potassium does is it helps relax your blood vessels, aids sodium excretion, that's getting rid of out of the body, and contributes to lowering blood pressure, because where sodium goes, water goes, and sodium is contributed to a higher blood pressure. So what dietary things have potassium in it? So we've got bananas, spinach, lentils, and salmon. There are other things. Dietary fiber. High dietary fiber intake is associated with reducing blood pressure. So about 28 grams a day for women and 38 grams a day for men. So again, these are just the rough estimates. You can have a look online and say, okay, where can I get increased dietary fiber from? Sleep optimization. I mean, this is a talk all by itself. And if you search Khan's YouTube page, you might find a blueprint to a good night's sleep, 2 videos, but from somebody you might recognize. It's on there. So why is poor sleep and sleep apnea can raise blood pressure significantly? Target 7 to 8 hours of good quality sleep a night. So it's not just eyes closed, eyes open. It's good quality sleep. And actually, if your sleep is of good quality, you can get away with less than 7 to 8 hours. The quality of the sleep is important. We were having a conversation before this started. You are a poor version of yourself if you have short amounts of sleep. So people who were saying, yeah, I can do 3 hours, 4 hours, 5 hours. No, that's not a thing. I would say between at least 6 hours to 7 hours of good quality sleep is important. You're not a good version of yourself without that. Sleep deprivation is linked to elevated sympathetic nervous activity and impaired blood pressure when you go to sleep. And did you know that I think it's a night of sleep is so powerful. A night of poor sleep increases your risk of diabetes, and it causes you to be as impaired as somebody who has drunk alcohol. So please optimize your sleep. Again, we don't have the time to talk about that in detail, but there is a talk about that on Khan's YouTube page. Cold exposure. Cold showers, cold water immersion activates the parasympathetic nervous system, which reduces inflammation, and it's shown to reduce systolic blood pressure, especially combined with breathing exercises. Now, again, so full disclosure, for the last 2 years, I think, I've been ending my showers in the morning with cold. And even this morning, I was like, oh my God, I don't want to do it. But we're back to being honest with ourselves. And I had to remind myself, what do I want most? Right now, I want comfort. I want the warm water. I don't want the cold water. And if I focus on that, then I'll stop. But what do I want most? I want lower blood pressure. I want activation of my parasympathetic nervous system. I want to be as healthy as I can for as long as I can. I don't want a problem in 10 years, 20 years. So, yes, it may mean discomfort today. But I'm happy to go through that more than problem later. That's a personal testimony. Cold exposure. So it reduces insulin resistant weight and blood pressure. So, okay, so sorry, this is not cold exposure. This is intermittent fasting. Excuse me, the slide's not changed. Intermittent fasting reduces insulin resistance and blood pressure. So those of us who are just like, oh my goodness, I just can't shift the weight. One of the things that you might need to do is fast. The body was designed, and when it was designed, there wasn't the same level of access to foods as there are now. So it's important to go back to God's original idea, because the amount of time that you're eating can be contributing to it, and fasting can be a great help in, changing the shape of your body, but also changing risk of diabetes and also improving your blood pressure. Laughter and social connection. Did you know that laughter and community reduces stress hormones? We talked about community before. We're now, although we've got all of these things to connect us, we are the most disconnected society ever. We're the most disconnected generation ever, because rather than maybe spending time talking to people and meeting up with people, if we're not careful, we'll allow the interactions that we get to be on a phone. I want you today, wherever, no judgment, I want everywhere you go today, I want you to look and see who's on their phone. There was a time when at the bus stop, maybe we would talk to each other on the bus, maybe we would talk to each other, but I want you to look at, we've got headphones on, we've got people are walking, looking at their phone, they're at the bus stop looking at their phone, no judgment, but you cannot connect in real life if you're doing that, and there's a whole body of evidence of what it's doing to our brains. But laughter and social connection reduces stress hormones. It boosts nitric oxide, which helps to reduce your blood pressure. And there's a trial that says that, laughter can significantly reduce diastolic blood pressure in older adults. And if you're interested, again, I've said before that the science is catching up with the Bible. The Bible says that a merry heart does the body good like medicine. Music therapy, classical, gospel, reggae, or any personally relaxing music, what it does is it slows your heart rate, it reduces sympathetic tone, and there are some studies that have found that music therapy can reduce systolic blood pressure by 5 millimeters of mercury. So think about so for me, one of the biggest issues that I was faced with when I had a stroke was my life had gotten so busy that I would wake up, put my feet on the ground, brrr, sleep. Wake up, brrr, sleep. And I never paused. I never had time just to give my mind a break or my body a break. And even things like now, I practice just stillness. I might sit down, I might put my headphones in, and I might just listen to something slow. Or I might just have my noise cancellation headphone in and maybe have some white noise and listen to nothing, but just so that I can take a break. Sitting down, relaxing, and music therapy, breathing, all of these things are free things. You can contribute to a lowering of your blood pressure by doing all these things. And the last thing I say, just change one thing. I've given you lots of information about lots of things. You don't have to do all of them, but change one thing and do that thing consistently. I'm a big believer in the one change rule, meaning that if you are consistent, persistent in and intentional about changing your life, and you say, I'm just going to change one thing, then you will likely, if you do that consistently, you will probably add more things that will contribute to better health. So I've said a lot of things today. I hope you've made notes, and or you're going to go back to the Khan YouTube page and listen to it and make some friends. send it to your friends and have conversations. We've all got WhatsApp groups that we're contributing to. We're talking about Love Island or Netflix show. Why don't we have a conversation about, well, my blood pressure is this. What do you think I can do? What do you guys do? Let's normalize conversations about health in our community. And with that, I want to say thank you very much for listening to me. I believe myself and Dr. Anaegbu are going to have some conversations. Thank you so much for listening.
Thank you so much. A round of applause from my end, and I'm sure everybody is doing the same, hopefully, from where they are. This was a fantastic, oh, look at the hands clapping all over. This was a fantastic presentation. I knew it was going to be this way. I mentioned it from the beginning, and it was what we expected and more. Thank you, both conventional and non-conventional. I did introduce myself at the beginning. My name is Dr. Nneka Anaegbu. I'm a GP partner in Horncastle, and I have a passionate interest for high blood pressure, hypertension, because I am also someone who is hypertensive on 2 medications. And we like this from this presentation, we know that Black people, we are at high risk. It's not anything you have done or not, or you didn't do. It just comes, but we can manage it, we can fight it with this sort of presentation today, and we are really grateful. And some questions have been coming in, which are really useful. So someone said, can you let me know, is it true there are particular blood pressure tablets that are not to be taken by Black men due to genetics? Is this true? There are particular methods of coming off blood pressure medication. That's from Art Hammerish on the chat.
Yeah, so good question. Actually, I thought it was going to be in my slides. I must have forgotten to put it in there. You're absolutely right. So, full disclosure, a lot of the things that we know about medicine in terms of the studies are historic studies that have been done over a long period of time. Now, there's a growing body of evidence that a lot of that data was on a certain kind of person, a middle-class white man. And we now know that not everybody, now we always knew, but maybe that's where the money was. We now know that some of that information that we have used to make our pathways and processes, it's not a one-size-fit-all thing. So for instance, there is the different kind of medication I talked about. There's the guidelines, the NICE guidelines, and the European Society of Cardiology guidelines. Historically, they used to split them by age. So if you were less than 50, you would have 2 kinds of medications, so A and B. And if you were over 50, it would be C and D. What we have found is, so A is ACE inhibitors. What we have found is that ACE inhibitors aren't as effective in a lot of Black people. Now, not everybody knows that, and your GP may not know that. So it's a conversation to have because the research is there. So for instance, when I was started on blood pressure medications, I was started on a calcium channel blocker because my GP was aware that actually an ACE inhibitor, even though I was under 50, it wouldn't be as effective in me. So it's not Black men specifically, it's Black people in general. ACE inhibitors are not as effective as other medications. So if you're on an ACE inhibitor, that's a conversation you can have with your GP because they may not be aware. In terms of the second question, methods for coming off blood pressure medication, absolutely fantastic, great question. I think it's important to make sure that as you set your intention with your GP and you guys have a program together. Because like I said before, because most people who suffer with high blood pressure don't have symptoms, symptoms can't be the measure of on or off. It's got to be consistent numbers that are showing evidence of, okay, well, this person doesn't need it anymore. And in general, it would be some form of regular monitoring and lifestyle change and adjustment over time, where you can see that consistently my blood pressure is lower than maybe when I first started. And then between yourself and your GP, you can say, okay, I think now after maybe 3 months or whatever, 6 months is a good time for us to try and be honest and willing to consistently check, because if it goes back up, it means that you need medication. And just to be honest about it, because there is a reluctance in everybody to take medications. And I'm just saying, we just have to be honest about the fact that for some of us, it might be an indefinite thing. It's great to have the aim, but let's not use emotional decision making when it comes to our health.
So thank you for that extensive response. There's the next question from Joanne. It says, is diastolic BP a thing? And what does that mean for effective medication option?
Yeah, diastolic hypertension. Yeah, so it is a thing. So remember, the blood pressure systolic is the contraction, diastolic is relaxation. So some people need medication because their diastolic blood pressure is high. And there's lots of things that can contribute to that. Sometimes it's being overweight and some other things and salt and whatever. So yes, you may need blood pressure medications or blood pressure interventions because your diastolic is high, not necessarily your systolic. But it's the same thing. So you can be looking at and say, okay, so now it's high. Have a look and say at reputable sites online, like the NICE guidelines and stuff, and just say what things specifically pertain to diastolic blood pressure. Have that conversation with your GP and go away and say, I'm going to then change what we call modifiable risk factors. So your genetics, you can't do anything about. You are who you are, you're born how you are, that's fine. But there are things that you can do that will contribute to modifiable risk factors. So maybe you're the kind of person who didn't have a problem having KFC every day. Okay, so we can modify that. We can change that. We can have home cooked food. We can do something else. Or maybe you're the kind of person who has 6 Maggi cubes every time you cook. So maybe we can reduce that to 3 or 2, modifiable risk factors.
Thank you. Some of the questions have already been answered from what you're saying, so we may skip some of them. And the next question says, what factors contribute to this high prevalence of hypertension in Black, African, and Caribbean population? Are there any prevention strategies to help reduce this disparity?
Yeah, great question. So genetically, our bodies retain salt in a way that our white brothers and sisters don't. So even if we eat the same foods, we are more prone to retain salt and therefore have high blood pressures. There are other things as well in terms of the things that contribute to blood pressure. There's some data that talks about things like stress. In general, so even if you want to break it down, things like microaggressions, interactions in life, having to deal with a society that's created for people who maybe not look like you or talk like you. So all of those things in society cause you to go through life having a different experience than somebody who might be exactly the same in every other reason, but they're white. So all of these things contribute to a higher prevalence of high blood pressure in Black people. I don't like the conversation about socioeconomic things because it assumes that all Black people are poor, and I don't agree with that. But there is evidence that people who live in lower socioeconomic groups have also a higher prevalence of high blood pressure as well. So if you're Black and live in that area and overweight, and let's say smoke and have diabetes, you're a sitting duck for problems, in 10 years' time.
Okay, thank you. The next question says, does GP get financial bonus for prescribing blood pressure medication? I think I can answer that one because I'm a GP and I'm a partner and I deal with finance relating to. So we get bonus for ensuring that our patient's blood pressure is controlled. We don't get bonus for prescribing blood pressure medication. That's why we call you all the time. Coming for your blood pressure, coming for your blood tests is mainly for you, not really for our pockets.
Yeah.
And why are some medications said to be better? You've answered that one already for Black people. Are there scientific reasons why Black people are more likely to have high blood pressure? I think you
We just talked about that,
have answered that. Do we also have studies if Black people in their native countries have high blood pressure similar to UK? I guess I'm asking if it's environmental, lifestyle factors.
That's a great question. So I don't know for sure. I don't know for sure, but that's a great question. I would argue that one of the things that we know is that the Western diet isn't great for long-term health, and we know that. So there are studies to say that some people who don't have a problem with, say, let's say colon cancer or whatever, move to the West and they adopt the diet of the West, their risk of these problems that were prevalent in the West increases environmentally. So I think there's absolutely evidence, I don't know specifically about high blood pressure, but that there are strong environmental factors. Yes, I don't know the data about like people in the Caribbean countries and African countries, but we do know that diet is different. And there's actually a growing, but I know somebody who's a Ghanaian nutritionist who wrote a book about the benefits of some of the West African things that we come over here and we start forgetting. But things like the cassava, and our home foods. I mean, we have to be mindful about the amount of seasoning and salt that we put in the stews, and the fact that, let's say, the fufu and pando and pounded yam, there's lots of carbohydrates in them. However, in terms of like the way that we cook our meat and things like that, there is evidence that some of that is healthier than when you compare it to Western diets. But yeah, there's research to be done. I don't have an answer specifically about that.
Yes, I agree with you because sometimes I look for research like in Nigeria, there's not much, maybe there's not much funding, but yes, like you said, there's a lot to be done. And Elizabeth has said, very useful conversation. I signed up for kidney donation due to high number of people waiting, being on the list. And also, once I started the process, my blood pressure was discovered to be high and was started on low dose, but I have been practicing some of the non-conventional treatments because I really want to donate because of us. If not us, then who?
Yeah.
So you're trying to be good in the long run. You were discovered to have high blood pressure, which is a good thing you may not have known. So
Yeah.
you're also saving yourself. Is there any difference in hypertension for Black people across the world, e.g., variants of Black dominated country versus, well, we don't know much about,
Yeah, I think it's the same question we just
right?
asked. So yeah.
So just most, and they're saying thank you for answering the question. Said Roxanne Anthony Henry said, thank you so much for answering my question. I'm from South America and in here about high blood pressure and diabetes. Where's a country? We are a country of sugar. That's what
Yep.
she said.
Yeah.
What's the earliest hypertension can
Can be
be
discovered. Yeah, I saw that
discovered?
question. So
Yes.
great question. So as I mentioned before in the talk, there is an increased prevalence of younger people being diagnosed with high blood pressure. So there's actually, Dr. Anaegbu will attain to this, that there's even a protocol for how we investigate young people with high blood pressure. So if you come and you're 50, 60 and you have high blood pressure, we assume you have what we call primary hypertension, which means that it's just you just have hypertension. When somebody, I've seen people in their 20s, who are diagnosed with high blood pressure, and for that person we investigate to say, is this secondary? Because there are other conditions where high blood pressure is part of it. So for instance, there are some genetic things, there are some endocrinology, so that's hormone things that might be the cause of it, and we haven't been able to find that, but we found the high blood pressure. So for us, let's say you see Dr. Anaegbu, you see me in hospital, not only will we start you on medication, but you'll have investigations to say, okay, does this person have an abnormality in the blood vessel that supplies the kidney per se? Or do they have a swollen heart? Or do they have a hormone imbalance? Because all of those things may be a cause of secondary hypertension, and we tend to investigate that in people who are younger. But yeah, it can be as young as in the 20s. The thing to bear in mind is, if you have high blood pressure in your family, you are more likely to have it in your life. So I would argue that by the time I would say by the time you're 25, if you have high blood pressure in your family, just get into the habit of checking, because it's better to know than not to know.
Thank you so much. We have run out of time and we have managed to put everything within 1 hour. That was a fantastic presentation. And thank you so much, Dr. Olatoye. I'll hand over to one of the, Ashanti.
I can't thank both of you enough. That was an absolutely amazing presentation, Dr. Olatoye, and thank you, Dr. Anaegbu, for the hosting. Having doctors take out their time and really give us these presentations. I mean, it's amazing. So today I will be going through our closing slides just to share more about what we do at Khan. Can we see my screen? Yeah. So our health hours, they're every Saturday. We do them every Saturday, and next week, please do tune in again. We've got a talk on endometriosis. To register, it's the email there. You can also sign up with the QR code. It promises to be a really interesting session. And we've got Dr. Eddie Edmond Asagi and also Dr. Jama. Equally upcoming, we have our Black Healthcare Awards in 2026. Nominations are now open. If you know any exceptional Black healthcare professionals that are making a real difference, our award categories are there. Please do nominate. We have to celebrate excellence within our own communities. I think, as someone said in the comments today, if not us, who? So the deadline is the 28th of February. Please contact and nominate, keep nominating. QR codes are there. Also, we have our 2026 COVID Reflection Day. 6 years on from COVID, we always come together and do a national service of remembrance. It's happening this time on the 8th of March 2026. It's in Manchester. So from 7 to 9, the QR code's there again. Please do register, come along. It promises to be a great night, as it's saying, great night of hope and reflection for the Black community. Also upcoming, we have our International Women's Day. It's so important to, celebrate women and the incredible women that are in our lives. And so this upcoming one is focused on health being wealth. It promises to be an amazing day filled with networking, cultural performances, and amazing talks. It's happening on the 12th of March, 2025. Please do reserve your spot. Again, any questions, the email is right there. Also, at Khan, we have a host of support services from domestic violence and sexual abuse down to even legal drop-ins. It's listed all there. Please do get in touch if you are looking for any support in any of these areas. And the helpline's also there. We are, as always, here to help. Also, it's so important to give blood if you can. As I said, giving blood does save lives. For many in our communities, it's really hard to find, suitable donors, especially with the prevalence of sickle cell in Black patients. So please do think about registering to give blood. There is so much time, still time, as it says, to make a difference in people's lives. And also, you feel better helping others, don't you? So please do. And yeah, that's basically it. Thank you so much for joining us, today. Again, thank you so much to our doctors. And we hope to see you next week and every week after that. Thank you.
Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network.